Hi, my name is Joe, and this is the first corresponding video to the Cultural Competence Assignment. In this video, we're going to be going over the case study for Jorge Arriola. First, I'm going to touch on some important information that you find in the assessment section, and then I'm going to skip to the intervention, where we're going to talk about how we incorporate cultural competence and cultural humility. So starting with the assessment, Jorge Arriola is a 54-year-old Hispanic male who presents with hypertension and type 2 diabetes. We have very little family medical history because he was raised in an orphanage. He does have an older sister who also has hypertension, and the patient currently lives with his girlfriend. No smoking, no drug use. Does drink 2 to 3 beers 4 to 5 nights per week. Diet consists of traditional Mexican dishes. Coffee intake twice a day, once in the morning, once at lunch. For exercise, the patient walks 1 to 2 times per week for roughly 30 minutes around the neighborhood. And then the patient was prescribed lisinopril but had an allergic reaction, so now they are currently on metoprolol for their hypertension and glucophage for their type 2 diabetes. Okay, now we're going to go to the intervention section, where we're going to talk about some interventions that incorporate cultural humility and cultural competence. The first thing I want to bring up is it is stated that the patient speaks both English and Spanish, but because we are going later in the intervention going to be mentioning some nutrition education, the first thing I want to ask is what language they prefer. Once again, we are going to be going over important information during that nutrition education, so we really want to make sure that the patient understands the information that we're providing. The next thing we want to do, because it does state that the patient is Hispanic, but Hispanic does encompass a wide range of ethnicities, different countries, different cultures. So we really what we want to do is confirm the patient's heritage. I believe the case study mentions that the patient is Mexican, so we just want to confirm that. From there, we talk about the food that the patient eats, traditional Mexican food. When we make our tweaks, in this case, we want to increase complex carb intake, limit processed food, limit canned food, so that we can limit the patient's sodium intake to less than or equal to 2,300 milligrams per day. We're not looking to change the foods that the patient is eating. We want to keep it where it is traditional Mexican dishes, but we're looking at things like swapping out the flour tortillas that the patient uses for a low sodium option flour tortilla, or maybe using a leaner cut of meat because the patient does intake beef. The other thing we want to do is ideally we would want to remove alcohol intake, but we do want to meet the patient where they're at. We can't make the patient give up alcohol. So if we can somehow limit it to no more than 2 cans of beer per day, that would be the maximum. And then from there, we want to move to asking permission to talk to the patient's girlfriend and kind of bring her in on what we're doing. Hispanic culture is very family-oriented, so I think it would be a good idea, after asking permission, of course, to have his girlfriend there, also learning the information that we're providing. That way she can be another level of support while at home. Then we're going to look at exercise. The patient mentions that they walk 1 to 2 times per week for roughly 30 minutes. If we can increase that at all, maybe starting with a small bump from 1 to 2 to 2 to 3 times per day, 30 minutes is still okay, perfectly fine. And then finally, as I mentioned earlier, we're now at the nutrition education part, nutrition education for blood pressure and nutrition education for blood glucose levels. As I mentioned, this is really where we want to make sure that the patient understands. So again, asking what the preferred language is, and then getting a translator if necessary.